Do you know what hypertension is and how it affects your health? Hypertension, often cloaked under the name high blood pressure, is more than just a jumble of medical jargon. It's a common health condition, a silent whisper of a warning that, if left unattended, can morph into a shout of serious health complications. Picture this: your heart, your body's dedicated pump, working overtime, pushing blood through your arteries with more force than it should. This relentless pressure can wear down your heart, damage your blood vessels, and pave the way for heart disease, stroke, and other health threats. But here's the silver lining. Hypertension isn't a sentence. It's an alert, a nudge to take action. And the first step in that action plan: understanding. Understanding what hypertension is, how it operates, and how it impacts your health. Because, as they say, knowledge is power. Understanding hypertension is the first step towards managing it effectively. What triggers hypertension, you might ask? Well, hypertension or high blood pressure can be caused by a variety of factors. Let's delve into some of the most common ones. Firstly, age plays a significant role. As we grow older, our blood vessels gradually lose some of their elastic quality, which can contribute to increased blood pressure. This is why hypertension is more common in people over the age of 60. Another pivotal factor is family history. If your parents or close relatives have hypertension, you're more likely to develop it too. It seems that high blood pressure tends to run in families, possibly due to shared genes and lifestyle habits. Next on the list is obesity. Excess weight puts more strain on your heart and increases the amount of blood your body needs to supply oxygen and nutrients to your tissues. This increased blood flow can cause your arteries to harden, leading to hypertension. Lack of physical activity is another key cause. Regular exercise helps keep your heart and blood vessels in good condition, reducing your risk of hypertension. If you lead a sedentary lifestyle, you're more likely to have high blood pressure. Now let's talk about tobacco and alcohol use. Both can cause your blood vessels to narrow, increasing your blood pressure. Additionally, the chemicals in tobacco can damage your blood vessels, while excessive alcohol can cause weight gain and other health problems that can lead to hypertension. Stress is another potential trigger. While short-term stress can temporarily increase your blood pressure, chronic stress can lead to long-term hypertension. This is especially true if you cope with stress in unhealthy ways, such as eating junk food, smoking, or drinking alcohol. Lastly, chronic conditions such as kidney disease and diabetes can also cause hypertension. These conditions can alter the way your body controls fluids and hormones, affecting your blood pressure. Identifying these triggers can help you understand how to avoid or manage hypertension. So, it's essential to be aware of these causes, as they can guide us in making healthier lifestyle choices to prevent or control high blood pressure. How can you tell if you have hypertension or high blood pressure? Let's dive into the symptoms and diagnosis of hypertension. Interestingly, hypertension is often referred to as the silent killer. Why, you might ask? Well, it's because hypertension doesn't always present with clear, noticeable symptoms. Many people with hypertension may not even know they have it. This makes it all the more important to be aware of the potential signs and to get regular checkups. So, what are some possible symptoms of hypertension? They can include headaches, shortness of breath, or nosebleeds. But these symptoms usually don't occur until high blood pressure has reached a severe or life-threatening stage. More often than not, there are no obvious symptoms. That's why regular blood pressure checks are so crucial. Now let's talk about how hypertension is diagnosed. The process is quite straightforward. Your healthcare provider will use a device called a sphygmomanometer, which includes a cuff that's wrapped around your arm and a device that measures the pressure. This device measures two types of pressure: systolic and diastolic. Systolic pressure is the force your heart exerts on the walls of your arteries when it beats, while diastolic pressure is the force exerted when the heart is at rest between beats. Hypertension is typically diagnosed when a person has a systolic blood pressure above 130 millimeters of mercury, or a diastolic blood pressure above 80 millimeters of mercury on 2 or more occasions. Here's a key point to remember. Even if your blood pressure is normal most of the time, but spikes during doctor's visits due to anxiety, you may still be at risk. This is called white coat hypertension, and it should not be ignored. So, even if you feel perfectly fine, don't skip those regular checkups. They are your first line of defense against this silent killer. Because remember, hypertension can quietly cause damage to your body for years before symptoms become apparent. Regular checkups are crucial to detect hypertension early and start treatment. So, you've been diagnosed with hypertension. What now? Well, don't fret. There's a whole array of treatment options waiting to be explored. Let's dive right in. First and foremost, lifestyle changes are the cornerstone of hypertension management. Indeed, a few simple tweaks to your daily routine can work wonders. Let's start with diet. A balanced diet is vital in managing hypertension. You'll want to focus on foods rich in whole grains, fruits, vegetables, and lean proteins. A diet low in sodium and high in potassium is especially beneficial. The Dietary Approaches to Stop Hypertension, or DASH diet, is a fantastic guide to follow. It emphasizes reducing sodium intake and consuming a variety of foods rich in nutrients that help lower blood pressure. Next up, regular exercise. It's recommended to get at least 30 minutes of moderate aerobic activity most days of the week. This could be anything from a brisk walk to a bike ride. Regular exercise helps lower blood pressure and keeps your heart healthy. Now, onto alcohol and tobacco. It's crucial to limit alcohol consumption and avoid tobacco entirely. Both can raise your blood pressure and damage your blood vessels, making hypertension worse. And let's not forget about stress. Chronic stress can contribute to hypertension, so it's essential to find healthy ways to manage it. This could involve activities like yoga, meditation, or simply taking time to relax and do things you enjoy. But lifestyle changes might not be enough on their own, especially for those with higher blood pressure levels. That's where medication comes in. There's a wide range of hypertension medications available, including diuretics, beta blockers, and ACE inhibitors, to name a few. Your healthcare provider will work with you to find the right one or combination that suits your needs best. Even with medication, it's essential to monitor your blood pressure regularly. Regular checkups with your healthcare provider are a must. They can help track your progress and adjust your treatment plan as necessary. Also, consider investing in a home blood pressure monitor. It can be a valuable tool in keeping tabs on your blood pressure levels and noticing any changes early on. Remember, knowledge is power, and the more you know about your condition, the better you can manage it. And finally, remember that managing hypertension isn't a sprint, it's a marathon. It's about making long-term changes and sticking to them. It's about not just treating hypertension, but also preventing its complications like heart disease and stroke. This might all seem a bit overwhelming, but don't worry. You're not alone in this journey. Your healthcare provider is there to guide you, and there are countless resources and support groups to help you along the way. Managing hypertension is a lifelong commitment, but with the right approach, it's entirely possible. So take a deep breath, roll up your sleeves, and let's tackle this together. Let's recap what we've learned about hypertension. Hypertension, often referred to as the silent killer, is a common yet serious health condition. It's characterized by consistently high blood pressure levels, which if left unchecked, can lead to severe health complications, such as heart disease and stroke. It's an aspect of our health that we can't afford to ignore. We've delved into the causes of hypertension, which range from lifestyle factors to genetic predispositions. Unhealthy habits like excessive salt intake, lack of physical activity, high stress levels, and excessive alcohol or tobacco use can all contribute to high blood pressure. On the genetic front, a family history of hypertension can also increase your risk. The symptoms of hypertension can be subtle, which is why it's often dubbed the silent killer. Some people may experience headaches, shortness of breath, or nosebleeds, but these symptoms only occur when the blood pressure reaches a severe or life-threatening stage. Hence, regular checkups are crucial for early detection and management. Speaking of management, we've also explored various methods of treating and controlling hypertension. This includes lifestyle modifications like adopting a healthy diet, incorporating regular exercise, limiting alcohol intake, and quitting smoking. In some cases, medication might be necessary to keep the blood pressure levels in check. Remember, each individual's journey with hypertension is unique, and so the treatment plan should be tailored to suit their specific needs and circumstances. In conclusion, hypertension is a serious health condition that requires our attention. It's essential to understand its causes, symptoms, and treatments. Early detection through regular checkups is key, as it allows for prompt treatment and prevents the condition from escalating into more severe health issues. So, let's not underestimate the power of knowledge when it comes to our health. It's our most potent tool in the fight against conditions like hypertension. Remember, knowledge is power. Understanding hypertension is your first step to a healthier life. Please subscribe and comment below. Your feedback helps us create more informative and engaging content for you.